Good afternoon and welcome to today's webinar, Broadband Access and Public Health, Legal and Policy Opportunities for Achieving Equitable Access, brought to you by the Network for Public Health Law and the American Society of Law, Medicine, and Ethics. I'm Charles Strong, the Senior Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. One of our presenters was unfortunately had to drop out because of technical issues. We hope that she's able to sign in later for the Q&A section, but otherwise her portion of the presentation will be included both in the presentation slides that get posted later today, as well as the video playback for the webinar. We will have her audio and slide presentation available in the playback that will just be posted today or tomorrow. We strongly encourage attendee participation and would love to hear from you, so feel free to submit your questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your questions. We'll be addressing them during the Q&A session towards the end of today's event. Your moderator for today's webinar is Betsy Lawton. Betsy is a senior staff attorney at the Network's Northern Region office, where she provides legal technical assistance, delivers presentations and lectures, and builds connections in many areas of public health law. Before joining the Network, Betsy spent over a decade working to improve water quality as an attorney with Midwest Environmental Advocates and the Minnesota Center for Environmental Advocacy, where she focused on the Clean Water Act implementation and enforcement, reducing agricultural pollution, and preventing drinking water contamination, and represented a broad range of individuals and communities facing water pollution problems. Betsy will be leading us through the rest of today's webinar, so Betsy, over to you.
Thank you, Charles. Thank you all for joining us today. It's great to have you with us. I'd like to briefly introduce each of our expert speakers and then provide a brief overview of the relationship between equitable broadband access and public health. As Charles mentioned, unfortunately, Loris Taylor, who has the presentation ready for us that wasn't able to upload today, will not be able to join us, but she'll be here for the Q&A, and her presentation will be available in the recorded playback that's available on the network's website. So I'll provide a brief introduction of Loris here, because we will be hearing from her during the Q&A, and you will have access to her expert materials later. Loris is the president, CEO of Native Public Media, which represents the media interests of Native Americans, inclusive of radio, television, journalism, and public policy. Her leadership resulted in the first digital journalism and storytelling curriculum for college credit, the FCC's tribal priority for broadcasting, the establishment of the FCC Office of Native Affairs and Policy, and the publication of the first seminal study on broadband, new media, technology, and internet use in Indian country. Next, we will hear from Egiel Casaperalta, a project manager with Amerind Critical Infrastructure. In 2016, Amerind Risk founded the groundbreaking Amerind Critical Infrastructure Division with the goal of helping tribes build and finance modern broadband networks. Prior to joining Amerind, Ms. Casaperalta established an independent legal practice where she served Indigenous peoples, nonprofits, and underrepresented communities in telecommunications law matters. Prior to law school, Ms. Casaperalta directed the Rural Broadband Policy Group, a national coalition of rural organizations advocating for policies to extend broadband access in rural communities. And lastly, we will hear from Matthew Swinburne. He is the Associate Director of the Network for Public Health Law's Eastern Region. He is a graduate of the University of Maryland Francis King Carey School of Law. He has 10 years of experience in public health law and policy and served as a law and policy analyst at the Center for Health and Homeland Security before joining the network. His current work focuses on issues of food safety and security, health equity, chronic disease, environmental health, and cannabis policy. So before we delve into the expertise of each of our presenters, I will spend a few moments just setting the stage with a brief overview of the relationship between public health and the digital divide. As the FCC has noted as far back as 2015, broadband is essential to participate in society, and households that lack internet access are at an increasing disadvantage as institutions and schools and even government agencies require internet access for meaningful participation in society. So broadband has been labeled by some as a super determinant of health, because broadband access significantly impacts all of the social determinants of health, and broadband equity is critical to achieving health equity. For those that may not be familiar with the social determinants of health, these are the conditions and environments in which people are born, live, learn, work, and play, and they affect a wide range of health outcomes and risks. Without broadband access, educational opportunities are diminished, and children may not be able to complete homework. They have a higher learning loss during summer periods, and now during the pandemic, they may not even have access to classroom instruction that has moved online. A lack of broadband access can also affect economic stability, limiting job seekers' ability to find and apply for jobs, and impacting job stability during the pandemic response. Without broadband service, households may lack sufficient access to health care, mental health care, and addiction services that are increasingly provided in a telehealth or other online setting. And a lack of broadband limits access to many social supports and opportunities for civic participation that have moved online, particularly during the pandemic response when social distancing is needed. Despite FCC's long-standing goals to ensure that all U.S. households have access to affordable internet services, today we still struggle to identify how far away from that goal that we are, and disparities in access abound. Unlike other essential infrastructure, broadband is largely provided by private companies without significant federal oversight over prices or infrastructure development. And this has led to two main barriers to access for households. The first is access, meaning that the technology and infrastructure is simply not available in certain areas where telecommunications companies may not view it as a profitable area in which to invest. And affordability is the other major barrier to household broadband access. And this can be particularly important in areas where there's only one service provider and prices are very high and may not be affordable for households. The other presenters will provide more detail on issues related to access and affordability. But as a preliminary matter, I just wanted to mention that there is a widespread concern that the FCC lacks accurate data on the extent of the digital divide, and that it can't yet be fully measured. So the GAO and other organizations estimate that many more households in America lack access to broadband infrastructure than the FCC does in its yearly reports. This has led to recent congressional action instructing the FCC to improve broadband access data. But that data hasn't yet been collected and reported. Regardless, nearly all of the data from a variety of sources make clear that access to broadband infrastructure is lowest in rural and tribal areas. And FCC's most recent data also shows fairly alarming numbers of households in the U.S. have not yet adopted a fixed broadband service, and this is likely due to affordability concerns. FCC's data does show lower rates of adoption in rural and tribal areas. There are also significant disparities in adoption rates in Black, Latino, and Native American communities. Black neighborhoods have much lower broadband adoption rates than white neighborhoods, and over 30% of Black, Latino, and Native American households with school-aged children lack home broadband. So eliminating the digital divide is particularly important to prevent a stark expansion of educational disparities, where children that lack home broadband service will fall behind in school. And the COVID-19 pandemic has impacted many parts of our lives, and it also impacts how we interact with the internet and broadband services. It's heightened the need for internet connectedness as employment and educational opportunities have moved online, and individuals are increasingly relying on telehealth to access healthcare opportunities. And at the same time, opportunities to utilize public Wi-Fi that was previously provided via libraries and school settings have diminished as those schools and libraries have shuttered. So the result is likely a drastic expansion of the health inequities tied to broadband access. Last, I just wanted to touch on what efforts are being made at the federal level to address the digital divide during the COVID relief efforts. So one of FCC's first earliest efforts was the Keep America Connected pledge, which asked broadband service providers to commit to waiving late fees, not terminating service, and opening Wi-Fi hotspots to any individual who needs them. But these voluntary commitments expired in mid-summer, end of June, and the FCC chairman has urged congressional action to ensure that individuals can remain connected throughout the pandemic response. The CARES Act, the Coronavirus Aid, Relief, and Economic Securities Act, also includes several funding streams that were meant to expand rural broadband deployment and to assist schools and libraries during school closures. But this funding alone is unlikely to remedy the public health disparities arising from the digital divide. And lastly, the federal government has made several revisions to its Universal Services Fund programs, and these are the long-standing programs that the FCC operates to relieve economic barriers to access broadband service. So a couple examples here. FCC has waived some of the restrictions that normally apply to its E-rate program, and this E-rate program provides discounts on broadband access to schools and libraries. During the pandemic, the FCC has temporarily allowed broadband providers to provide free mobile hotspots and broadband-enabled devices to schools and libraries that then can be utilized by students who lack home broadband. However, the FCC has not authorized the use of the E-rate funds that schools and libraries would be receiving to provide broadband service directly to students that lack home broadband. And this could have a significant if this was allowed under the E-rate program, it could have a significant increase access to educational opportunities for students that lack home access to broadband. The FCC has also made some temporary changes to ease application requirements for households that are newly eligible for its Lifeline program. And this Lifeline program provides a monthly discount on household broadband service for lower income households. And there are many newly eligible households as the pandemic economic toll has created many households that can no longer afford services. And then the FCC has also recently launched the Connected Care pilot program, which would help improve access to telehealth, and will fund the purchase of broadband services for patients that lack broadband service at home. So with that brief background, I am going to pass it over.
Thank you for that introduction. I want to say a little bit about Native Public Media. We are a national organization dedicated to assisting our tribal nations in securing broadcast facilities, and we currently have 59 radio stations, 3 television stations serving tribal communities across 19 states. And you can learn more about our work at www.nativepublicmedia.org. So COVID-19 really turned our world upside down, but it also really polarized some of the lessons that we ought to take to heart. No one can dispute that high quality data collection, for example, is critical in addressing a pandemic. In the top table, 20,021 positive cases of COVID-19 and 714 deaths were reported from the 12 regions of the Indian Health Service. County and city health facility data is less forthcoming regarding Native American patients. And so the tribes have really taken on the responsibility of tracking their own citizens. And on that same date of August 20th, the Navajo Nation reported 9,573 positive cases and 498 deaths. Now in that chart below, which is the new reported cases by day on the Navajo Nation, you'll note that the COVID-19 was at its highest during the month of May. And then as you look at August, it's really tapering off significantly. So likewise, high quality data is necessary to ensure that public broadband deployment efforts are not only cost effective, but prioritize areas that are either wholly or significantly lacking access. Under the current reporting protocols, the FCC considers a census block served if a single residence in the block has access to broadband. This practice overstates broadband availability in larger rural census blocks, and the FCC's use of, quote, maximum advertised, unquote, and not actual speeds when mapping broadband coverage distorts reporting on the service customers receive. Native Public Media is an advocate for service in high-cost areas. The absence of potable water, electricity, paved roads, 911 services all compound health disparities that are caused by the lack of medical personnel, personal protective equipment, beds, and morgues across Indian country. Infrastructure is expensive in less densely populated areas, but just as necessary. In places like these, COVID-19 has raged freely and was only abated by some of the most stringent health directives issued by tribal governments. Tribal nations face many of the same barriers to the deployment of communication services. These include rural, remote, and rugged terrain, areas not connected to a road system, minimal access to middle mile and long haul fiber optic cable, and difficulty in obtaining rights of ways to deploy infrastructure across tribal lands. These factors can increase the cost of installing, maintaining, and upgrading infrastructure. The FCC's 2020 Broadband Deployment Report estimates that 27.7% of Americans residing on tribal lands lack fixed terrestrial broadband coverage, compared to 22.3% of Americans in rural areas and 1.5% in urban areas. However, a 2018 GAO report, that's the Government Accountability Office report, asserts that the FCC overstates broadband coverage on tribal lands. Native Public Media is an advocate for technological advancements. Telehealth has become a staple for many tribes. The Indian Health Service, under the Department of Health and Human Services, provides care delivery for approximately 2.6 million Native Americans and more than 578 tribes. Other tribes use their own funding to launch community clinics. Both integrate virtual care into their efforts to offer high-quality, culturally sensitive health services. Currently, IHS and tribal clinics use telehealth for a range of disciplines: behavioral health, dermatology, cardiology, maternal health, infectious diseases, and more. But the benefits go beyond the clinical. Medical transportation costs for patients in the Northern Plains, the Desert Southwest, Alaska, and other isolated areas can be extensive for a financially struggling population. In South Dakota, tribes use virtual care to support IHS emergency and increase access to primary and specialty care. In Arizona, the Navajo tribal communities of Pinon, Kayenta, and Shanto have created virtual programs in collaboration with the Flagstaff Medical Center. Even the Havasupai tribe has a virtual clinic at the bottom of the Grand Canyon. The Pine Hill Health Center Medical Department in New Mexico, serving the remote community of Rama, is accessible only by dirt roads. Patients receive remote consults for cardiology, dermatology, and other specialties without needing to leave the reservation. Telemedicine is a game changer for everyone, but its benefits are often most dramatic for those with the most need, like Native Americans. Internet speed matters. The current definition of high-speed internet, according to the FCC, is 25 megabits per second download and 3 megabits per second upload. This definition does not correspond with the requisite download and upload speeds necessary to support businesses, education, and healthcare applications. Download speed is the rate at which data is transferred to the consumer, and upload speed is the rate at which data is transferred from the consumer to the internet. Typically, broadband delivered by fixed wired technologies like cable modem and fiber provide higher speeds than mobile wireless and satellite broadband technologies. Download and upload speeds can determine what kinds of applications are possible for broadband users. For example, baseline download speed requirements for a hospital to share health records, to perform virtual consultations, and to connect with first responders would require a download speed of 1 gigabyte per second. That's a lot of bandwidth. Native Public Media is an advocate for greater investment into broadband for public health. Tribal nations face challenges securing funds through federal broadband deployment programs. A 2018 GAO report included a review of 4 federal broadband programs, 3 from the FCC and 1 from the U.S. Department of Agriculture, and found that from 2010 to 2017, less than 1% of funding has gone directly to tribes or tribally owned providers. Now here's the problem. Many rural tribal communities are incompatible with the business model for private broadband investment due to the high cost of infrastructure and the low number of customers in potential service areas. Without a solid business case, many rural tribal businesses and citizens are at a competitive disadvantage compared to those in urban and suburban areas with robust broadband access. But tribes have not been idle. Some tribes have sought to expedite broadband infrastructure deployment by adopting Dig Once policies, granting non-exclusive and non-discriminatory access to rights-of-way, and facilitating efficient co-location of new broadband infrastructure on existing structures. Congress and federal agencies are encouraged to leverage community anchor institutions in rural communities to spur connectivity to surrounding areas. Now, if you don't know much about tribal homelands, the anchor institutions are primarily tribal governments, hospitals, schools, and law enforcement. At Native Public Media, we support efforts to advance to and through policies that provide flexibility to incentivize additional private or public broadband infrastructure investment beyond connected community anchor institutions. In order to close the digital divide across Indian country, we need spectrum. In 2010, Native Public Media worked with the FCC to establish the tribal priority for broadcasts. More recently, the FCC used that foundational work to establish the tribal priority for the 2.5 gigahertz spectrum. Access to spectrum is critical for tribal nations. In February 2020, the FCC opened the priority filing window for rural tribes to access 2.5 gigahertz spectrum in advance of an upcoming spectrum auction. This spectrum is well suited to provide low-cost broadband service in rural areas. Then COVID-19 happened. COVID-19 shut the doors of tribal governments across the country, and for several months now, only essential service stores have remained open. COVID-19 has had a profound impact on the largest and historically significant opportunity to secure spectrum for tribes. Well, we fought hard, but we did not get the 180-day extension tribes needed to fully participate in the 2.5 filing window. What we do know is that the priority field has not changed when it comes to spectrum allocation. So what can we do to move the dial? We can use our voice to help the least connected acquire affordable, high-speed broadband. We can advance policies that don't discriminate against communities because of geography or the rural nature of their homelands. We can restore net neutrality, which has proven its critical importance in disseminating information about COVID-19 prevention over a free and open platform. We can acknowledge that a one-size-fits-all is not the right business model, but that a combination of approaches will help us to close the digital divide in and across Indian country. We can articulate the need for dedicated funding and spectrum to increase broadband deployment across Indian country. And finally, we can all support the principle that broadband must be universal and ubiquitous. Asquali Dawae, thank you for being here.
Hi everyone. Thank you so much for inviting Amarin Critical Infrastructure to this amazing webinar, Betsy, and to the network. My name is Ajay Casaperalta, and I am the project manager with Amarin Critical Infrastructure. And so I just want to give a little bit of info about Amarin. Amarin, our parent company, Amarin Risk, is actually the only 100% tribally owned, unoperated insurance carrier in Indian country. And so we are really well known throughout Indian country as an insurance provider. And we have various, service offerings that are available to tribes. And in 2016, our board of directors really wanted to think through a new line of service that could really support building Indian country and tribal governments. And so at that time, we considered energy, transportation, and broadband service because we thought that these industries and these services are critical to building tribal governments and tribal government services. And after that consideration, we decided to go ahead with focusing on helping tribes connect tribes by building their own modern broadband networks. I am the newest team member of our team, and I'm very lucky to work alongside two experts in broadband issues in Indian country. Our general counsel, Jeffrey Blackwell, and our ACI director, Irene Flannery, are both were the former chief and deputy chief of the Office of Native Affairs and Policy at the FCC. So our team is pretty steeped in federal internet access issues and have a specific focus on making sure that tribes have access as well. So that's just a little intro about me. I want to provide a little bit of context also for broadband services in a community in general, but obviously talking a little bit about how broadband is a tool for tribes. So you probably have seen this little graph that shows kind of all the services that a a government, a local government or a tribal government, could use internet service for. So as you point out, there's healthcare that is most pertinent to this conversation, but there's also education, public safety, libraries, infrastructures and schools, and housing, right? So these are the kind of sectors that a community, a local government, a tribal government would need internet service for. And I want to point something else out in here. There are two internet customers. There are individuals and there are institutions, and that includes government institutions. And to make sure that we live in healthy communities, we need both of these customers, both the individuals and the institutions, to have access to reliable, affordable, high-speed internet service. So for individuals, we want to make sure that you and I, as individuals in a community, have access to reliable internet service so that we can access healthcare in our modern society. But our institutions, our hospitals, our nursing facilities, and you all are most familiar with these institutions, they also need to have high-speed, reliable internet service to be able to provide healthcare services and to create healthy communities. I wanted to make that distinction so that as we have this conversation, you keep in mind that we as individuals need internet service, but our institutions also need internet service for all of us to live in a healthy society and community. I don't have a slide for this next portion, but I wanted to mention internet access figures in Indian country to provide a little bit of context of what tribes and Native communities are facing. This year, in April, the FCC released its Broadband Deployment Report. And in that report, which is released every year by congressional mandate, the FCC kind of looks at the state of broadband access in our country. So this year, the FCC said that overall, 94.4% of our population in the United States has access to 25 at 3 megabits per second. That means that's kind of like fairly speed internet service. That most of the country, just about 6%, 5.6% of our country does not have access to the service. By the end of 2018, that's what it was. The FCC in that report said that rural communities in rural areas, only 22.3% of people living in rural areas do not have access to this, fast speed service, broadband service. And in tribal communities, only 27.7% of people living in tribal lands don't have access to the service. And in urban communities, only 1.5% of people living in urban areas don't have access to broadband service. This was this year's FCC report. Contrast that with what we learned from the American Indian Policy Institute at Arizona State University. They released the study last year, at the end of last year, and there's and we'll talk a little bit more, I think, in the webinar about the inaccurate numbers that we're getting in terms of internet access across our country. And the FCC themselves have been mandated by Congress to collect better data because their numbers are inflated. The American Indian Policy Institute at Arizona State University put out a study where they surveyed almost 300 participants that live in tribal lands, live in Native communities in 19 different states. And what they found was that, they found some interesting information. For example, when it comes to access, most of the participants use their cell phone to access the internet. 22% use a laptop or a desktop. And so really what we know is that in tribal lands, internet access is primarily through your cell phone, which has implications for the type of delivery of healthcare delivery that you can offer. we also found that not everyone has actually reception for their cell phone in their home. Only 69% of the people that participated in the study found that they have internet access via their phone in their home. Other people have to walk around somewhere, maybe at the top of the mountain or at the top of, drive into another area to be able to even get reception on their cell phone. And another interesting bit of information that came out from the study is that the top 3 locations where residents living in tribal lands use the internet are: first is wherever they get cell phone reception, that's where they connect, wherever there's cell reception. Second is where there's public Wi-Fi while they are patronizing a business, where they are, like a McDonald's type of place, or the last one is at a friend's or relative's house. So this, I want to share this to contextualize that internet access, even though our federal government is kind of saying, oh, we're very, very connected in our country, we do have other sources of information and anecdotes, right, that you all probably know that your internet service is not always there, is not always reliable, it is very expensive. So we have additional information challenging that perception that 94.4% of our country has access to broadband service. So I just want to give that a little bit of context. And then I want to talk about what the federal government has done in terms of internet service in our country. So the Federal Communications Commission was created in 1934. It's actually a pretty old agency, and it was tasked to oversee commerce and communications in order to make communication services available to all people in the U.S. And back in 1934, there was not the internet, there was radio. And so the goal was for everyone to be able to access radio communications and eventually phone. In 1996, when we passed the Telecommunications Act, that's when we actually formalized 4 of these programs that Betsy spoke a little bit about in her presentation. And these are called the Universal Service Fund programs. So the Universal Service Fund is a pocket of money that we all contribute to. If you look at your cell phone bill or your phone bill, you'll see a line item there every month that should say Universal Service Fund. Every telecommunications provider is supposed to contribute to this fund, which its goal is to ensure that telecommunication services are available to all people in the United States. And we understand that we need some funding for that. And so the providers are supposed to put money in that pot, but they just pass the cost on to the consumer. So you'll probably see like a $2, maybe less than $3 cost each month on your cell phone or telephone bill. And that cost funds these 4 programs that you have a graph for in front of you: the Lifeline program, the High Cost program, Schools and Libraries programs, and the Rural Healthcare program. I want to point out that these 4 programs and the Universal Service Fund recognize that there are infrastructure needs for institutions to access the internet, and that individuals also need support. So 3 of these programs focus on infrastructure: the High Cost program, Schools and Libraries, and Rural Healthcare. High Cost, brings a pot of about $4.5 billion each year. This program focuses on providing reduced rates for telecom and broadband service in eligible high-cost areas. So we recognize that building broadband networks is an infrastructure project that is costly, and that the more remote and the less populated the community, the less incentive a telecommunications company will have to go and build a network there. So we try to give them some incentives by saying, hey, if you build here, you have access to this funding. So that's a high-cost program. The schools and libraries program is pretty much focused on making sure that schools and libraries have the necessary funding to have telecommunications and broadband services in their institutions. And that is capped at $4.15 billion each year. The rural healthcare program is capped at $571 million, and it focuses on healthcare institutions. I'll talk a little bit more about it. So these three focus on institutions, and the Lifeline program focuses on individuals. We know that even if you have internet service, you might not be able to afford it. And so Lifeline provides reduced rates for eligible low-income consumers to be able to pay their internet bill. The support doesn't go to the individual. The support actually goes to the internet provider. So the internet provider gives the individual a discounted rate. For people that are outside of tribal lands, that the general program offers, I think it's they contribute $9.25 to your internet bill or your cell phone bill, and you can determine, how helpful that is. I think that might cover taxes. And then if you live in tribal lands, we understand that the needs are higher in Native communities and remote tribal lands. And so the funding for tribal lands is $20, I believe. So more pertinent to you, this is all background, but more pertinent to the people likely participating in this webinar is the Rural Healthcare Program. As we said, it was established in 1996. But it provides funding for telecommunications and broadband services to eligible nonprofit or public rural healthcare providers. And here you see the 8 types of providers that are eligible to participate in this program. And like I mentioned earlier, it is capped at $571 million annually. Historically, this program was underserved, and now I think people are becoming more aware that there's a pocket of money is available and are applying to it. The goal of the Rural Healthcare Program is to improve the quality of healthcare to rural residents by helping eligible healthcare providers access the telecommunications services they need to serve those communities. So there's 2 components to that program. The first one is if you're a community mental health center or a local health department, a nonprofit hospital, a rural health clinic, a nursing facility, and you need help accessing voice and data services, then you would apply for the telecommunications program. If what you need is broadband service, you apply for the Rural Health Connect Fund. These are the 2 programs within the Rural Healthcare Program, and they have been around before the pandemic. This is one way in which our federal government recognizes we need to make sure that healthcare institutions have telecommunications and broadband services. What happened since the pandemic is that we really recognized that individuals need to be able to also access, internet service to be able to conduct their daily lives. And so as a response to the COVID-19 pandemic, as you know, the government passed, the Congress passed the CARES Act. In that act, they allocated $200 million to the FCC to help healthcare providers provide telehealth services to patients. And so the FCC created the COVID-19 telehealth program. Now, this program is specifically trying to respond to the pandemic. The idea is that if healthcare providers need support providing telehealth services to respond to the pandemic, to respond to patients that are experiencing COVID, or just to respond to patients in general so that they can create more, so that they can have more bandwidth to respond to all other patients. Here also, this program started on April 13th, and unfortunately stopped receiving applications on June 25th. It was a first come, first served type of situation. Like it was applications for funding were evaluated on a rolling basis. Nonprofit and public healthcare practitioners were the only ones that were eligible. The same eligibility entities that were eligible in the rural healthcare program were eligible for this program, with the exception that non-rural entities were eligible here. So you did not have to be a rural healthcare eligible practitioner provider to be able to qualify for the COVID-19 telehealth program. One of the things that we heard about this program specifically is that a lot of the smaller healthcare providers in rural communities, it was too burdensome to be able to participate and submit their request for reimbursement for telehealth services. So it wouldn't be surprising for you to know that, these type of complicated, evolving programs that are at the federal level are probably most accessible to really established institutions that have maybe a law department and a grant writing department that can be dedicated to keeping up with the rules and the emerging regulations that came through this. Next thing I want to talk about are two things that the FCC is actually the two initiatives that the FCC has to address internet access, not as a result of the pandemic, but in general. So the previous conversations we had, was about the healthcare program that was already in place, then the government's response for telehealth, particularly in response to COVID. And there are two other initiatives that I'll touch on briefly that the FCC has undertaken to close the digital divide. One of them is the 2.5 gigahertz tribal priority window. This is actually kind of wonky, so I won't spend too much time here, but it's the opportunity for tribes to obtain a license, a spectrum license, which would allow them to build a wireless internet network. This is this has not happened before. This is the very first time that the FCC provides such a window for spectrum licenses in this way. There was one for radio, which is also spectrum, but this is specifically for building wireless internet service. And the FCC said federally recognized tribes, Alaska Native villages, and Hawaiian homelands in rural areas. There's a big focus at the FCC this administration on rural communities. So these entities can qualify and get this license. This spectrum, like I said, can create high-speed wireless broadband service, can provide that service. And what is critical about this opportunity is that it puts tribes in control of the provision of service. So when we're talking about institutions being able to have access to the internet, sometimes you cannot convince a company to come and serve your community for whatever reason. They think you're too poor, you're too remote, you're not worth the investment. Here, tribes can have a license to be able to build the internet network themselves. So it puts them in control of the provision of service. And also, a spectrum license is a valuable economic asset that a tribe can leverage in negotiations with other providers. The window actually closed yesterday. We'll wait to see. The FCC still has to review applications, make sure that everything is in line, and then award the licenses. And then we'll see, hopefully, deployment, building of networks in Indian country as a result of this initiative. We can speak more about it later if you want to get wonky. And the other one that I'll mention is the Rural Digital Opportunity Fund. This has been a bit controversial because we don't have accurate data. The FCC created this fund, which is $20.4 billion for deploying internet service. It's a reverse auction model, which means if you want the money, you tell us how much money you want, and we'll give the money to the person who asked for the least amount of money. I can explain that more later on. But this means that eligible telecommunications carriers or entities that are able to become ETCs can receive, can participate in this reverse auction funding model. In phase one is set to the auction for phase one, which will auction off $16 billion, up to $16 billion in funding, will take place October 29th of this year. And then phase two is yet to be determined. The reason why this has been controversial is because the FCC said that there are the only places that can that are part of this initiative are quote unquote census blocks where no provider is offering or has committed to offer service of at least 25 megabits down and 3 up based on Form 77 data. So if we go back to what the FCC this year said, hey, as of 2018, 94% of Americans have access to broadband, meaning 25.3 megabits per second, then there's only about almost 6% of the areas of the census blocks that are eligible for this $20 billion. So the data issue is a bit complicated in this and has received a lot of scrutiny from advocates and the public in terms of how the FCC will distribute this money and why are we distributing this much money when we don't even really understand the depth of our broadband connectivity issues in the country. And now I think I've taken more than enough time. I'll pass it over to Matt. So thank you.
Everyone, Matt Swinburne with the Network for Public Health Law's Eastern Region Office in Baltimore, Maryland, and I'm going to talk to folks today about municipal broadband. And municipal broadband is when local public entities enter the commercial marketplace for high-speed internet. And this is really an effort that involves all three levels of government, federal, state, and local, and there's actually quite a bit of drama associated with this effort. So I'm going to build off some of the stuff that the other presenters have already touched on. The idea of, well, what is the scope of the problem that these municipal entities are trying to help out with? And folks have talked about the FCC already, and the Telecommunications Act is the piece of law that creates this responsibility for the FCC to try to determine what the access is in the United States for high-speed internet or broadband. And so they have this duty to put out a deployment report every year, and that's where folks are discussing these numbers that are inaccurate, but I'm going to explain why these numbers are problematic. So these are the numbers that folks have discussed about access, whether or not the infrastructure is in place in a community to get that broadband speed internet. And then the report also looks at adoption, you've got access in communities, but can people actually afford that internet? And so the report also provides the adoption rates of this technology in communities across the country. But the reason we have problems with the data that the FCC puts out every year is kind of their definition of access. So according to the 2020 report, there are 18.3 million Americans that lack access to this fixed terrestrial broadband. Now, how do they get this data? Well, they use something known as Form 477. And essentially, the industry, the internet service providers, provide information on this form, and a census block is considered to have access to broadband if at least one household in the block has access. Now, you can see why this is problematic. For example, in Alaska, there's a census block that is 8,500 square miles. So for that entire census block to be considered covered by the FCC, only one household in that census block needs to have access to broadband. And so it really paints inflated numbers in terms of access. Now, a nonprofit, Broadband Now, did an independent study, and they estimated that rather than 18.3 million Americans lacking access, it was closer to 42 million Americans. Now, this has been an issue. This Form 477 has been an issue for a while that folks have recognized. And finally, this year, the Broadband Data Act was passed by Congress that really is trying to get at more granular data. So it mandates that the FCC gather that more granular data, but also provide a mechanism for the public to challenge that data. So if the data that the FCC is collecting doesn't, kind of connect with what communities are seeing on the ground, there has to be a process for them to challenge the data. There has to be a process for the FCC to crowdsource its data collection. And, the Data Act is really, the issue that was talked about before, federal funding relies on this information. So with this more granular data, the FCC is going to need to make new coverage maps and use those to inform their broadband funding. So this is one of the challenges that the FCC has been gathering this poor data on the Form 477 that has painted an overly rosy picture of what's going on. And so, when you have 42 million Americans on on another estimate, more than double what the FCC is saying, it's going to take a lot of resources and a lot of parties to try to solve this problem. Now, this has already been talked about is, why do we have these disparities in access? And it's, the issue of installing the infrastructure that's needed is expensive, and it's not profitable for private internet service providers when a community is isolated or low income because they fear they don't have the customer base to recoup their investment. Now, this is where municipalities come in. They don't have a mission to make profit, but to serve their communities. And so there is this kind of movement of public entities entering the commercial telecom market to provide high-speed internet services. And currently there are 331 municipal broadband networks in the United States. When these slides are available, I have a hyperlink there so that you can see all the municipal broadband networks, see the ones that are in your state or your community. Now, when a municipality or local public entity decides that it's going to work to provide high-speed internet to its community, there are three basic models that they can adopt. One is public ownership, and that's kind of, a local government would act exactly like Comcast or Verizon. They would build the infrastructure, they would finance it, and then they would operate it once it's built. The other major categories are public-private partnerships, so local government and working with private internet providers to make that service available. And there are a lot of different forms of partnerships that can take. Local government can provide the private companies access to government land. They can provide access to infrastructure conduits. They can provide government funding to incentivize, or they can do something that's known as kind of the wholesale model of municipal broadband, where the local entity will build the infrastructure that's needed, but then will, have a private internet provider run those services within the community. So there are a bunch of different ways that there can be partnerships. And then the last model is the cooperative model, where it's rural electric and telephone cooperatives add high-speed internet to the kind of services they offer. So those are the three basic models of how, local governments and local entities are trying to fill this gap that has been created with regards to broadband access. Now, this is a really controversial topic, and there is pushback on this movement of municipal involvement. But before we get into that pushback, I want to look at some of the arguments for it. And some of these are really straightforward. It provides access to broadband in areas that are underserved or unserved. That issue of private companies, with their, profit motive, overlook communities that aren't going to provide that profit, and with a different mission and a different drive, municipalities can come in and serve these. Well, municipalities, when they do provide service, can provide that service at comparable or better speeds at potentially lower costs. There have been studies that have shown that municipal broadband provides excellent customer service, better speeds, and at lower costs. And some of the ideas is, municipalities don't have the same costs as a private company does. And, it can pass these cost savings on to its customers or the people in their community. Now, another thing is, a municipal broadband network can input competition into a market to essentially, provide the competition that can drive private internet service providers to up their game, so to speak. And this is important because there are a lot of communities that are deemed to have access who only have a single provider in their community. And so this 45% number comes from a 2016 report from the FCC. Increase in investment in local communities, having this resource in the community draws economic opportunity, business to those communities, and as we mentioned, this kind of follows in the tradition of municipal-based utilities. So here are some of the arguments for it. Now, here are some of the arguments against that, government entering into the field of telecommunications in this way is unfair competition. They have inherent advantages that private companies don't, like right-of-way and public financing. Another argument is that, there's potential risk for taxpayers if this endeavor fails. There are municipal broadband networks that have failed. There are also those that have been extremely successful. So this argument's brought out. Folks have also argued that, there are limited, local funds, and this, takes away from other priorities that the local government should be funding. And lastly, that having this municipal entity in the broadband marketplace discourages private sector investment, that, private sector isn't going to want to go to a community where they already have competition or potentially could have competition from the local government. So these are the arguments against. These are often made by the large internet service providers themselves. And where we've seen these arguments made is at the state level, that there's been a lot of lobbying to restrict the deployment of municipal broadband services. meaning states have passed laws that make it difficult or outright ban municipalities from creating broadband services. And so I have this map here of the 19 jurisdictions or states that have passed legislation that serve as kind of a roadblock to local efforts. And I'm going to go through a couple of examples here just so you can see the range of state laws that are in play. Now, some of these are fairly straightforward. Missouri has a complete ban on municipalities and municipal electric utilities from providing retail or wholesale telecommunication services. So that covers broadband. And again, the wholesale telecommunication services would, this is a bar of, let's say, a local community installing the infrastructure and then leasing it to a Comcast, a Verizon, a Spectrum. So they can't even do that. Missouri has one exception to this kind of flat ban on municipal broadband, and they allow municipalities to develop broadband for their internal government use. So some states have these flat out bans. Now, some kind of have private priority. They don't want municipalities to enter the field if there are private internet service providers who are, and I would use air quotes, interested in providing services to these communities. For example, Michigan requires a public entity to request bids for services before they can, move forward with establishing a broadband network themselves. So, if they receive less than 3 bids, they're allowed to move forward with their municipal efforts, but only within the boundaries of their municipality. And they've got to subject themselves to the same terms and conditions they put in those RFPs. So that's an example in Michigan. Pennsylvania has a similar restriction where municipalities can't provide broadband unless they contact a local provider, and that local provider refuses to provide service within 14 months. Now, when they talk about access in Pennsylvania, there are issues, of, again, how we define access. So data speed is the only thing that they can consider when they're determining whether or not they have access. They can't consider the affordability aspect. So, okay, you may have access to high-speed internet, but it's cost prohibitive for your community. And in Pennsylvania, you can't develop that municipal network that would be more affordable for the community. So you have this kind of private preference or first opportunity to private providers. Now, Florida places taxes on municipal broadband networks that they don't require of other public utilities. And it's this way to, essentially inflate the operating costs of municipal broadband. And also, Florida places a profitability requirement on municipal broadband. They have to have a roadmap so that they are profitable within 4 years. And if they're not, they have to hold essentially a public hearing to determine whether or not to continue providing those municipal services. Alabama, here you see a restriction that's used sometimes where they limit the funding sources that municipalities can use to kind of cover the capital costs or the operating costs of this project. And Alabama prevents municipalities from using tax revenue to cover the capital costs, and they're also prohibited from using appropriations of state, county, or municipal funds. So they really limit their ability to acquire funding, but there are other funding mechanisms available to municipalities. Now, Virginia does something very interesting, and there's some states that do this. They allow municipalities with who provide electric utilities to also provide broadband, but they require them to impute the costs that their private sector competitors would have into their rates. So the idea of all the cost savings you could generate being a municipal government is removed, because you're forced to impute those costs into your rates, so that you kind of lose that affordability factor. And the state of Virginia flat out says that municipal broadband can't charge rates lower than the incumbent service providers. So there's some of this price fixing and these phantom costs, these imputed costs. So this is another technique that states have used as a roadblock to municipal efforts. And the last example I'll look at is Tennessee, because Tennessee plays into a big, a legal battle from a couple of years ago that we'll talk about. Now, Tennessee has some procedural and service area restrictions. They require municipalities to submit detailed business plans to the Office of the Comptroller, and the Office of the Comptroller provides feedback on the feasibility of their plan. And these municipalities then have to have a public hearing once they have that feedback, and present their plan and the feedback either for the municipal legislature to vote and approve this plan by 2/3 vote, or they open it to a public referendum. So they have some of this procedure up front before they can move forward. And then once you have that, there are some service area restrictions. Where can they offer their services? So if a municipality also operates an electric utility, it is limited to providing broadband services to their electric service area. They can't expand outside of that. Now, if a municipality doesn't operate an electric utility, they can only provide broadband to historically underserved areas, and it has to be in partnership with a private sector internet service provider. And this term, historically underserved area, is squishy. And to determine whether or not something is an historically underserved area, they have to essentially apply to the state to see if the state, determines that the area they're hoping to serve is historically underserved. And so, in this analysis, there are a couple of factors. Do they not have broadband access? Has it been a residential area for at least 5 years? And is it outside the service area of some of the traditional providers? Now, I said that Tennessee would play into a legal battle around municipal broadband. And this is where we really see all three levels of government come into play and how they interact. Now, in this, folks need to understand the concept of preemption. Preemption is when a higher level of government can override the laws of lower is not a value judgment, but just within the preemption, a lower government. For example, the state can preempt the laws of the local government, and that's what we're seeing, with municipal broadband, states putting these laws in place that prevent municipalities from doing certain things. Well, the federal government, when they have authority, it can supersede state law. So in the critical scenario here, Wilson County, North Carolina, and Chattanooga, Tennessee, had developed really successful municipal broadband networks. And the surrounding communities that were underserved came to them asking them for service. But in both of their jurisdictions, the states had laws that prevented municipal broadband from expanding beyond their service area. So, the states, not the states, but the municipalities, reached out to the FCC asking them to override these state laws, to issue an order overriding these laws. And this was really controversial at the time, that the House of Representatives passed a measure that was going to freeze the FCC's funding if they overturned the state's prohibitions. Now, the FCC at the time took the side of the municipal governments and issued an order blocking these state laws. And so they essentially preempted these restrictive laws that hindered municipal government. Well, the states brought a lawsuit against the FCC and said, you don't have authority to do this. You can only preempt us when you have the authority to do so. And so the FCC says, well, we do have the authority. That Telecommunications Act, says that, we have to do something. And the language they relied on is, provided here. The Commission shall encourage the deployment on a reasonable and timely basis of advanced telecommunications capabilities to all Americans by utilizing measures that promote competition in local telecommunications markets or other regulating methods that remove barriers to infrastructure investment. So they based their authority on that. They argued they were removing barriers to infrastructure investment, and they were ensuring the deployment of these advanced capabilities. Now, question is, did the courts agree with the states or with the FCC? Well, and this is the chairman of the FCC at the time, Chairman Wheeler, and in this court decision, the FCC lost. And what the court said is, states have the right to set the boundaries of their telecommunications policies for the municipalities in their jurisdiction, unless Congress has provided a clear statement to the contrary. And the FCC was like, what about these, this language in the Telecommunications Act that we're citing? And the court held that that language we looked at the last slide wasn't a clear statement of authority from Congress, so the order of the FCC didn't stand. And one of the things that they pointed out in their opinion was there was a similar case back in 2004 where municipalities were challenging Missouri's complete ban on municipal broadband, and they wanted the FCC to come in and preempt that complete ban. And at the time, the FCC actually said, we can't preempt it because we lack a clear statement of authority to do so. And so this was brought back to kind of haunt the FCC in this case. So, this was the outcome of the case, and Congress hasn't changed any legislation that would give FCC the clear authority to come in and preempt these 19 states that have legislation that's kind of a roadblock to municipal development. In fact, the current chair actually wrote a dissent in the original order because, it was his viewpoint, that they didn't have this authority. So the federal government, can't intervene right now, or at least the FCC can't intervene right now to make things easier for municipality governments with regards to these state laws that inhibit the development of municipal broadband. That is my last slide. Thank you for your time. I really appreciate it. And I guess I hand things back over to Betsy.
Presentations. I appreciate the information. And I did want to make sure that there is some awareness about how you can ask a question. We've gotten several great questions, and I want to make sure everyone has the ability to ask those questions. So Charles has just posted some instructions for how you can get your questions in the queue for our wonderful presenters. But in the meantime, I just want to provide Loris a few minutes to give a couple highlights of your presentation. It will be available to all who have signed in today on the network's website. So you will be able to have access to Loris's presentation. But given her broad expertise on these matters, Loris, would you mind giving us, a 3 or 4 minute highlight of what your presentation covers?
Oh, absolutely. First of all, hello to everyone. Askwali Umayasa Niqam Iki. I am from the Hopi and Acoma Nations. I reside in Arizona, and I apologize for not having my slide presentation available. I'm suffering from serious internet issues. Our entire area is out, so we're dark. And so how ironic that is that we're talking about broadband today. But let me just talk a little bit about Native Public Media first. So Native Public Media is a national organization, and we're dedicated to providing tribes with the assistance to secure broadcast licensing. And so currently we have 59 radio stations and 3 television stations serving the 578 tribes across Indian country. Of course, not every tribe has a broadcast facility yet, but our hope is to make sure that they're connected in some way to a communications platform, and certainly broadband is one of those technologies that is of super importance in terms of communication. So I want to just give a little highlight of how COVID-19 is affecting Indian country. There's been a lot of stats out in the news in terms of the numbers. And so the latest numbers that I have come from August 20th. And if you don't know, the tribes across the U.S. are segregated into 12 regions under the Indian Health Service. And so on August 20th, 20,021 COVID-19 positive cases were reported. Out of that, 714 individuals died from the virus. One of the most hard-hit tribes was the Navajo Nation, which of course is the largest tribe, the largest land-based tribe in the U.S., and they have over 9,000 cases of COVID-19. And from my small village on the Hopi Reservation, we have 100 community members, and we have 8 individuals that are affected by COVID-19. So it's been really devastating, and of course, it's really polarized the need for telecommunications and communications across Indian country. And every crisis, I know, is very information-centric. And so this is one of those issues that has brought broadband really into the spotlight. And I've been in this business since 2004, and I've never had really an opportunity to see so much interest in broadband across the board. But I want to talk specifically about why tribal lands are grossly underserved in terms of broadband access, and why reliance on market forces are ineffective to increase deployment and penetration across Indian country. So one, we know that the FCC is charged by Congress in the Communications Act with allocating and administering spectrum in the public interest, and that certainly includes tribes. And I know that Congress also charged the FCC to accelerate the availability of affordable high-speed broadband internet service to all Americans. And for some reason, and besides numerous factors, tribes have always lagged behind. The FCC concedes that tribal lands have been and are grossly underserved, and I know that at Yale pointed out the percentages of how many residents on tribal land still lack access to broadband speeds. And I've had my own relationship with members of Congress. I've had numerous conversations. And on the whole, back in 2004, when we first started advocating for broadband, we used to hear remarks like, well, who would want to build a highway out into nowhere? But I want to let you know that Indian country is somewhere, and that the digital divide on tribal lands is the latest example of that historic disparity. But I also want to mention that the reliance on private sector market forces alone will not bring the benefits of affordable, high quality broadband service to tribal lands. And why is that? Well, one, we have a low population density. And so high-cost areas is described by poor roads, the lack of transportation infrastructure, no running water, the lack of other amenities that we take for granted in cities and towns, and the difficult terrain of tribal lands that contribute to making tribal homelands unattractive to private sector market conditions for utilities or commercial broadband service providers to build and operate systems there. And so one thing that we've learned is that we know that a one-size-fits-all model in terms of increasing broadband deployment to Indian country is not what we see as most beneficial to tribal nations. I think what we need to do now is to look at other models and different approaches to increase that penetration across Indian country. So at the end of the day, I want to mention also that bridging the tribal digital divide is not just about infrastructure. It's about bringing the same affordable, high-speed broadband resource that most Americans enjoy and that we would like to enjoy. Currently, I can tell you that there's a huge migration of our students going online to get their instruction. And talking to families, you cannot imagine the hurdles that they're going through right now. One, across the Hopi Reservation, for example, very few homes are connected to the internet. The connection is primarily to anchor institutions that are law enforcement, schools, hospitals, just these huge institutions that where the internet doesn't flow out to the residential areas. And what we're seeing is that we're seeing our young kids having to go to hotspots. So on the Hopi Reservation, we have one hotspot in the middle of the reservation. And speaking to a mother a few weeks ago where she has two children who are in elementary school, they take turns on their handheld, and at the end of the day, they've spent about 4 hours trying to get instruction at the hotspot. And I can't imagine how those conditions will become worse when the snow comes and when it's cold. The drive for them is about 30 miles round trip from their house to the hotspot. And I know that this is not uncommon, this is happening, but it's also happening in terms of our access to public health. We have some tribes that are connected to virtual clinics that are offering specialty care or connections to emergency health care, but not every tribe is that fortunate. In Arizona, we have some communities of the Navajo Nation who, in collaboration with the Flagstaff Medical Center have virtual clinics up and running. We also have a small virtual clinic down in the Grand Canyon with the Havasupai tribe. And so there's that promise, but to do that, we need the necessary speed. And the current definition under the FCC, 25 and 3 on the download and upload, is not enough to meet that requirement. I checked into this, and the NTIA, which is the National Telecommunications Information Administration, states that you need about 1 gigabyte to do that sort of service. And so there are a lot of things that we can do together, and I encourage you to watch my fabulous PowerPoint when you do have the time. But I want to end by just pointing out a few things in terms of moving the dial. One is that one of the, I think, positions that we need to advance is that we must help the least connected acquire affordable high-speed broadband. And it can't be just any speed, which is usually the case for poor and rural areas. Just so long as you connect them to the internet, it's fine, but it's not fine. We need high-speed broadband in order to close the digital divide. We have to advance policies that don't discriminate against communities because of geography or the rural nature of their homeland. This has been a huge issue for Indian country. We've had many occasions where providers have leapfrogged over entire tribal communities or cherry-picked their customers. That's not a good business model, and that's not conducive to closing the digital divide. And we have to restore net neutrality. If anything has been apparent during COVID-19, it's been the use of a free and open platform to disseminate prevention strategies against COVID-19, washing your hands, social distancing, staying at home. Some of the most stringent health directives have come from tribes. The Navajo Nation implemented a 57-hour curfew every weekend starting on Friday at 5 p.m., ending at 5 a.m. on Monday morning. We also have to acknowledge again that one-size-fits-all business model is not the right approach for Indian country, and that we have to look at hybrid models, secondary markets, and other ways to connect Indian country. And I want to point out something that one of the panelists pointed out, in that funding, dedicated funding is hard to come by. And I believe there was, if I could just find the information, in the 2018 GAO report, 4 federal programs were reviewed, 3 from the FCC and 1 from the USDA. And it found that between 2010 and 2017, less than 1% of funding went directly to tribes and tribally owned providers. So again, data collection is important. If you don't have accurate data and you don't have the numbers to tell the story, that funding is going to remain out of reach. And then here's the big one. Broadband has to be universal and ubiquitous. The spirit of the law includes everyone, including tribal citizens. And I think that our efforts going forward have to reflect the spirit of the law, and that we have to do better in terms of connecting everyone in this country. So thank you again. I've been having, as I mentioned, serious internet issues, but I did produce a PowerPoint for you to talk a little bit more in detail about Indian country. So I hope that you take the time to view that PowerPoint. And I thank you for all being here today.
Thank you, Loris. That was a great summary of the information, and I encourage everyone to log on to your internet that is hopefully working in the next weeks and view Loris's presentation that will be on our website as well. We are running up against the close of our time here, but there were a few questions that have been submitted by attendees. I want to let you know that we will be going through all of those questions and providing responses as well as we can here in the next week or so. So we will be providing a response even if we can't get to your question today. But there's a few questions that I'd just like to throw out there to see if the presenters have some time to respond to them. There was mention that there are several federal efforts that are ending, including the COVID-19 telehealth project and the 2.5 gigahertz tribal priority window. And there was a question about whether there are new federal efforts underway to increase access. Do any of the presenters have any insight they want to share in response to that question?
Hi, this is Jael. Yeah, I think so. I think that there's the COVID telehealth program was a result of the CARES Act, and so hopefully in the next, I think our efforts that are like that, and that not only that don't only focus on telehealth, but focus on providing funding to extend internet service, will be up to our representatives' desires to provide those fundings in the next few months. I also want to point out that the COVID telehealth project was it didn't do anything to create new access. You still have to have internet access at your hospital or your health providing site, and the individual still has to have a reliable internet connection at their home or wherever they're receiving the health. It just provided the funding for a provider to be able to pay the cost of the telehealth, either equipment or service. And I think in terms of, I know that one of the other programs that has been under discussion in terms of from the federal government is potentially increasing the funding for Lifeline, which helps you pay, gives you a discounted rate on telephone or broadband service. That hasn't come to fruition yet, as far as I know, but the conversations are, I think people are advocating for that. So that's something that could happen. Again, Lifeline doesn't extend internet where there is currently no internet service. And the final, I guess the other things I'll say is that with the 2.5 gigahertz priority window, so yesterday tribes was the last day for eligible tribes to be able to apply for this license. The FCC is still determining, now begins the process of figuring out whether the tribes met all the requirements to be awarded the license. Then they'll have to determine who gets the license. That'll likely take months. But eventually, hopefully, the entities that have applied can receive a license that can begin to build. The Rural Digital Opportunity Fund is the next big initiative to increase internet service, to build the infrastructure where the infrastructure does not exist, so where their service is not available. That is still coming in October, and we'll see how the FCC handles that, who gets awarded, who knows. Those are the efforts that I'm aware of.
This is Laura. I would like to just speak to the 2.5 gigahertz window. In 2010, Native Public Media worked with the FCC to establish the tribal priority for broadcast spectrum. And building on that foundation, the FCC opened the rural tribal priority window for 2.5 gigahertz spectrum. Now, this is a very suitable spectrum that tribes are relying on right now to connect their communities and their residents. But what's very disturbing about this particular window is that when it opened in February, COVID-19 hit around the same time. And so tribes have not fully participated in the number of days provided by that window because tribal government doors closed just like everyone else across the country. They closed their doors, so they were not operating at 100%. And so very early in February, Native Public Media and MuralNet wrote a letter to the FCC and requested that they extend the closing of that window for at least a year. We didn't get that extension. The FCC, and there were many others who also petitioned the FCC. The FCC decided to give only 30 days to tribes. So even today, tribes are not operating at 100%. And if you don't have your engineers, you don't have your people, your tribal council in place, there's no business taking place. And so the 30-day additional extension closed yesterday, September 2nd. The spectrum will now go to auction. And once that spectrum is gone, it's gone. And so I feel very strongly that I think that window should have been extended a full additional 180 days to allow tribes to fully participate, because if you have a window open and you're not able to participate because your government is not working, that's not a full window. So I'm hoping that there will be another opportunity, but this was historic. This was historic for Indian country in that it was the first tribal priority for spectrum allocation in terms of broadband. I don't know when we'll get another window. I'm hoping that we'll have another window soon, but that's a serious issue for Indian country. Thank you.
Can I just second that real quick? Absolutely. Loris is absolutely right. Amarin was also really active in requesting the FCC to extend that window by at least 180 days. I mean, a year would have been fantastic. It was so unjust that the window opened while the pandemic was, we were all beginning to cope with it. And the one other thing that is happening, and as Loris points out, it was a historic window. We only got those 30 measly days. Representative Deb Haaland introduced a bill in Congress called, I believe, Digital Reservations Act that builds on the efforts of organizations like Native Public Media, advocacy of Amarin Critical Infrastructure, to say that this window shouldn't apply to one band of spectrum, it should apply to everywhere, and that tribes are the rightful property owners of the spectrum over their own lands. And so there's that is one effort that's taking place right now that I think tries to create a broader opportunity than the window provided, than the tribal priority window provided.
Matt, did you have something you wanted to say in response to this question? I know we're over time, and Charles may have to say we're done now. But
I can't remember what the original question was. I was going to bring up the Digital Reservations Act, but that's been taken care of.
Okay. Charles, is there anything else we should discuss before closing? And we will respond to the rest of the questions, over the next couple of weeks. And I thank all the great panelists.
I don't think so. Just like Betsy said, we will be reaching out to attendees who submitted questions that we were unable to get to. And just a reminder, the playback and the slides will be available by tomorrow.
Right. Thank you, everyone.